All right. Well, another exciting presentation coming right up. And now we have joining us Tricia Benn on the topic of holistic insights and business impact. Tricia is the Chief Marketing and Strategy Officer and the U.S. Managing Director for Northstar. And she shared with me that she has been involved in marketing research in the industry for 20 years and absolutely loves the evolution of insights, which she tells me is looking at new technologies, new approaches, and strategic visions to maximize the benefits of adoption as soon as possible. So please join me in welcoming Tricia. Thank you, Tricia.
Thank you. Okay, so it's absolutely fantastic to be here with you this afternoon. We're going to talk about insights and holistic insights in terms of where it intersects with healthcare, technology, and marketing, and what that means in terms of the insights industry and the impact we have within our organizations. And I was reminded at lunch, I don't know if Eric is here from our discussion at lunch today. What really brought this home for me many years ago is I was part of the National Association, the one that we have in Canada, where we were in planning discussions, and we had a lot of discussion about, you know, the voice of the consumer and the citizen in market research and how important that is and so on. And suddenly I thought, wait a second, we're not here for that. There are civic groups and, you know, so on. We're here to drive our businesses forward. And I had some pretty hands-on experience with that, being client-side, taking a traditional client-side cost center into a revenue-generating business for the organization that I worked with at that time. Now, I'm not going to talk about that today, but I'd love to talk more about it later if anyone wants to. First of all, I'd love to have just a show of hands. How many client-side researchers do we have? Supplier-side researchers? Okay, marketers? There we go. John has to hold his hand up twice. Okay, technology? We're representing? Okay, great. So we have a little bit, not too many on the client side today. I think that for all of us across all of those areas of focus, when we get our insights program right, we know that we have done something great. We can all agree to that. The second thing that I think is so important, and Lisa touched on this morning, when is the time to innovate? It's always today, or it's not an innovation. So the second thing that I think we can all agree on as we look at this kind of area is the fact that we're trying constantly to push the boundaries. And I think in the market research industry, we have to keep focusing on that. It's so exciting to see the explosion of technology, methodologies, all the different things that we're doing over the last few years, because our industry wasn't so embracing in the early days. Lisa mentioned I don't know how many of you were involved in association discussions around online research and how, whether it would be an acceptable form of data collection. But I sat through, I don't know, thousands of hours. We still never came up with some kind of mark of quality for online research. It just sort of was dropped as it became less and less relevant as even a discussion point. So first what I'd like to do is just start out with a point of view and just kind of frame what we're talking about in terms of healthcare. And I think the presentations today have been absolutely fantastic. I think we could easily say that the healthcare industry is the most complex, and I probably won't have any arguments from anyone in this room. Financial sector, they'd probably argue they have something to be said for complexity, but when you look at the emotional connection, the fact that this truly is life or death for the patient in many cases, it's that much more complicated. And when you look at the stakeholder interactions, obviously it's incredibly complex. And so, I have a very simple list there: patients, medical professionals, administrators. Patients, we have patients, you have children of patients, parents of patients, you have caregivers for the patients. medical practitioners, you have nurses, nurse practitioners, physicians, specialists, surgeons, et cetera, et cetera. And then, of course, administrators in all the different levels. And that's not taking into account the whole ecosystem, obviously, of pharma, insurance, government, and so on and so forth, manufacturers and so on. So it's incredibly complex stakeholder interactions. The business of healthcare, and I love that John mentioned earlier that it's good to have a successful business, and we had a little conversation about that. Doing good business means that you get to make great decisions, and to John's topic, he talked about marketing for good. So the business is critical. Getting that right, getting it smarter, faster, and obviously there are huge challenges there with increasing costs, reimbursement for Medicaid, Medicare. You've got tightening up of any new drugs coming on the market, not to mention endless other issues and challenges from a business perspective. Obviously, there have been huge regulatory and reform issues, and I know you know all about this, and certainly we've had a lot of discussion today about that. In terms of key trends, and again, I've just picked some things that I think are interesting. There's so many that impact the healthcare industry, but new food and exercise trends, breakthroughs, myths, fads, these impact all of our healthcare professionals and the patient, obviously, and all of the products that are being produced and marketed and so on. The consumer focus, we're doing a lot of work where we're taking best practices from CPG work that we do and juxtaposing that onto healthcare work, really looking at the patient no longer as the patient or the client, all these transitions, right? Now the consumer. And that changes everything. And obviously the empowered patient is a big part of that. And again, we've heard about that earlier today. Behavioral modification through technology, again, absolutely phenomenal. We'll talk more about that. Coordinated healthcare, the ability for healthcare professionals to actually coordinate healthcare for an individual through electronic records and various other technologies that are available. Advanced treatments with new technology. I love this one. I think there's so many different things you could say, but 3D printing of body parts. I'm endlessly fascinated with where that's going to go, what that means. Obviously, implanting is going to be a lot easier with this type of thing as well. And then finally, targeted approach to therapeutic protocols. Years and years ago, I worked with Sanofi for about 18 years, actually in total, on a thought leadership program, and we started work about 15 years ago on what about bioengineered medicines, and could we coming up with wording to try and explain it to people and what it meant and how much would they be willing to pay for it, because of course that's a huge issue and so on. And now here we are, we have that, and certainly it's an issue that we need to be addressing. And it was raised earlier, you can have this medicine that costs this much or this one that's really, really effective, but costs much, much more. So when we bring this back in terms of what it means for research, I think what's really exciting is thinking of that sort of bioengineered prescription the same way that we think about an individual and how we message to them, how we communicate to them, and help them to move forward. So we not only have this empowered individual, but we have this phenomenal willingness to share information. How many people are wearing a Fitbit? Anybody? I gave up on my Fitbit. I just wasn't being effective with it anymore. Carrying a phone that's tracking all of your walking and various other things. Yes, okay. Still hands up? We got almost everybody already. Okay. And I don't know if you're like me, incessantly adding in what you're eating into apps. There's my CEO, he's doing the whole sleep tracking, so his phone is with him while he's sleeping. We're sharing just an unbelievable, unprecedented amount of information. And that means that we really can, unlike any other time before, target engagement to the individual. And our job as insights leaders within our organizations is really to drive home the advantages of that and adopt these new technologies as quickly as we possibly can to have those better outcomes, certainly for a patient, obviously, and drive the business forward, which is critical to having the success with patients or consumers as they are now. So the connectivity is more than just wearable devices. I loved the Google presentation talking about the glucose monitor and the contact lens. You know, the extent of that is certainly tremendous and will continue to grow. There's social media, there's mobile apps, and it goes on and on. And what this means practically from a market research perspective, and you know, I'm definitely glass half full when it comes to pretty much everything except renovating, which I'm in the process of doing right now. But really, we have the opportunity now for increased access. It's you know, and that's the fact that it's more affordable, it's easier to reach people, and so on. We're you know, the age-old question. Everyone, come on, everyone in this room has been asked the question of, is that really what they do, or just they say what they do, right? So now we actually are monitoring real behavior, not reported after the fact behavior, which leads to the real-time analysis, that we actually know what's happening in real time. And Deepak now has us all concerned about who's tracking behind us and what we're doing in every moment. And then certainly greater representation. I think, you know, there's all kinds of ways that we can be looking at actually ensuring that our data is representative of the groups that we're looking for, as opposed to just really using crude measurements or estimates in terms of even demographic, but certainly behavioral metrics. So as we turn this to the marketing lens, and I think, you know, obviously this is incredibly critical. We have to market what we're doing to our targets and help them to move forward. And we know that mass marketing really isn't working for marketers anymore. I mean, there are the odd case, I suppose, where we'd say, okay, it does. But essentially, what we're trying to do is allocate our resources much more effectively to target the message straight through to the right target. And I think that's where customized insights that brings in all of the new trends and understanding we have within healthcare, the new technology that we have access to now. You can well imagine we pride ourselves on being great collaborators because we love all of this. What it does is it leads us to a whole different level in terms of marketing. And what I love to say is this is me marketing. I did not coin this phrase. I was at a C-suite conference recently and heard this term. I think it's absolutely fabulous. When you think of me marketing, it's that efficient engagement of strategies geared to the individual. And the healthcare industry couldn't be more perfect for this type of approach. It is all about me. If I have a 99% chance of not getting a disease at some point, that's well and fine and great, unless I'm part of the 1% that does, right? So the whole notion of me marketing and really being able to access the individual when and where they need the message is incredibly powerful. So really what we're talking about is insights to impact. It's streamlining our efforts, our resources to ensure that we really are targeting through to the individual with the right message at the right time, and then being able to monitor and adjust and iterate as we go along and monitor the behavior as an outcome of that. And practically from an insights perspective, we've got certainly a number of tools we can be using. We've had a lot of discussion today about mobile platforms, online communities, social media, web IDIs. I think there's just a million other ways we know we can be collecting data now, and I think our job is to really embrace that and pull it in as best we can. I think Lisa mentioned this morning, it's a lot easier to innovate when your budget's cut. We were working with a very, very large brand recently, and they wanted to do extensive ethnographies, which is great, but they're time consuming and they're incredibly expensive when you start adding them up and the travel and so on. And so what we did was we got them to agree to half being Skype interviews. And it was absolutely fascinating because we were able to collect the information in both formats and actually found that we were able to create more intimacy with the Skype interviews in many of the cases than we were showing up with 4 people and a video camera to somebody's home. So I think we need to take advantage of every opportunity we have to really break those boundaries down and move forward and share our learnings. So, oh, there we go. So commodity versus currency. We've had this conversation for years, but I think it's just, it can't be emphasized enough. Today, data is being generated at an alarmingly fast rate. We suffer from too much data. And I think as an industry, the insights industry has been hit probably harder than any other professional services offering, with the cold hard fact that data is just a commodity. And we have to move much further past that. So, I think at the end of the day, the currency of insights is really how we strategically marry what we know about the healthcare industry, adopting those new technologies as quickly as we can in collaboration to get to that strategic outcome from a marketing, also from a business strategy perspective and how we move the organization forward. Speaking of which, I love the Chief Research Officer title. I've been speaking about that for years. I think every organization should have a Chief Insights or Research Officer that really is at a senior level able to drive research insight through the whole organization, not just marketing. That's another speech. And so in conclusion, I just want to say my goal for this 20 minutes was just to start a conversation. I am going to be here after the sessions and certainly for the cocktail. I'd love to hear about your experiences in terms of the opportunities that you're seeing and certainly the challenges that you're facing in your organizations. Thank you.
Thank you, Tricia. We do have some time for some questions. Any questions for Tricia? I'm sure somebody has something.
Can you record those Skype interviews?
Yes, you can.
Can you repeat that, please?
So that was...
Can you record those Skype interviews?
Yeah. So you can record Skype interviews. What I would say is that it is a little challenging. So they don't record beautifully. So you do need a backup if you need visuals, which is what we did. So we took all the learnings from the Skype, but the visuals we took from the other ethnographies that we did. Mm-hmm.
Great. We still have a couple more minutes. Additional questions? I do have one, Tricia. So in utilizing the Skype for the interviews, how did it work? Oftentimes clients want to view those kinds of things live and be able to ask questions and things like that. How did you handle that?
So much like we find in market research, generally speaking, we said, oh, this could be a problem, and but we're going to figure it out, and we'll ask permission, and so on and so forth. We asked every one of them if we could share it with our client, et cetera, and got their permission. Every single one agreed. And it's very much in line with what Deepak was just talking about, where people are willing to share. And we assured them it's not going out onto YouTube or something like that. But yeah, it was not an issue at all.
Okay. And as far as getting physicians who are Skypers, was that any kind of challenge?
So in this case, we did. It was the consumer side. So we didn't do it with the physicians. So has anyone done Skype interviews with physicians? Okay, so it's our challenge. Oh, there we go. And well, yeah. Okay.
They're a little distracted with their phones just as they are interviewing, so just make sure that they're willing to.
Okay, so for the recording,
distracted.
so for the recording, just a little bit distracted, but it worked really, really well with physicians. From a couple of people here have done that work.
Awesome. Okay, anything further for Tricia? Wonderful. Tricia.